to our next episode of the Hormone Café. Today we're going to talk about something that is very important because it can be really frustrating, and that is what to do when you feel like nothing is working. Because sometimes we have gone to a number of different doctors, we've changed our exercise, we've changed our diet, we've changed our supplements, we're actually maybe starting to feel good, but we still are missing something, right? We still feel fatigued, we still feel low energy, we're still not able to get pregnant. So I'm going to walk you through one of my patient cases that I took care of and talk about some tips of what we do when nothing's working, because one of the hardest moments in our fertility or our hormone journey is when we feel like we're doing everything right and nothing is changing. So sometimes we have to figure out when to do multiple things and when to do one thing at a time, what to do when we're feeling stuck or discouraged, and how to continue to trust in our body and not give up on our bodies. So this episode, we're going to talk about not doing more, but how to think, what to check, and how to support ourselves mentally and physically when we're in that space where we just feel like nothing is working. Because sometimes when we feel stuck, we panic, we jump to extremes, we try to change everything at once, we change nothing at all. So feel like nothing is working doesn't mean nothing is working, okay? It just means that we have to either give it more time or change strategies, things like that. But let's start I want to tell you about one of my sweet patients. Her name is Emily. She's 31 years old and she had one baby, and she came to me because she has really, really, really irregular bleeding, and she's been having it for 4 years. So even as a teenager, she had irregular bleeding, and then she conceived her first baby, and then literally for 4 years, she kept having this really irregular bleeding. She would bleed for 35 days straight, and then she would stop bleeding, and then she would spot every single day. And she had been working with a naturopath, and she had tried a lot of different lifestyle changes and diets and testing and mold testing to see what on earth is going on. Why is she bleeding so much? So when she came to me, she was sugar-free, she was gluten-free, she had a really great gut, she had a regular bowel movement every day, she didn't have any bloating, she had a really good sleep. On her blood work, her hormones were looking okay, she had an okay estrogen, her brain hormones were okay, her thyroid was okay, she had had a pelvic ultrasound, she had been taking supplements, she had been tracking her cycle with a needle. So she said, oh my gosh, Dr. P, I've literally been doing all of these things for 4 years and nothing is working. I still have this crazy, crazy bleeding. I'm bleeding all the time. I've done this diet change. I've done this labs. I've done this ultrasound, and we just cannot figure out what is going on. So when we dug into it on her ultrasound, she does have really PCOS ovaries, and on her blood work, she did end up having really severe PCOS. And that is something that she hadn't considered in the past. For example, maybe I have PCOS, but it really helps to do a complete blood panel to figure out, okay, how severe is your PCOS and what exactly do you need to do about it? So in her case, we just did a couple little tweaks. For example, sometimes being gluten-free and being sugar-free can be good for you, and sometimes it cannot be the right thing for you. For example, sometimes women do need carbohydrates, or sometimes when we're gluten-free, we end up eating a lot of rice or almond flour, and sometimes those things can actually be really inflammatory and spike our blood sugar. So it turned out that being gluten-free was actually really inflammatory for her body, and so we actually had her do more of a keto-type diet. And she also had pre-diabetes. So she did a glucose monitor. She learned what spiked her blood sugar. She learned that she really doesn't do well with carbohydrates or sugar at all, and that she feels really, really great when she's on keto. And then we had her take some PCOS supplements, for example, myo-inositol, and then she started going on walks to help her metabolism. And then her iron was also extremely, extremely low. She had been just bleeding for so long that she had just been bleeding out all of her iron. So we started her on iron. And when your iron is low, your blood flow is not going to be good, right? Because you're literally not having enough red blood cells to bring oxygen and nutrients to your cells. So checking your iron is extremely, extremely important. And then We also did an endometrial biopsy on her to look at her uterus lining and see why she had been bleeding. And it turns out that she had chronic endometritis. So she had a chronic infection inside of her uterus, and she had a piece of retained placenta inside of her uterus. So I think that's another big talking point is sometimes when we have a diagnosis, we just chalk up everything to that diagnosis. So for example, sometimes when people have PCOS, right, they have irregular cycles or metabolic issues or irregular bleeding, and it's just easy to chalk up everything to your PCOS when there could actually be multiple things going on. I see that a lot with people who have endometriosis too. They have endometriosis and they have pelvic pressure, they have gut pain, and they just kind of chalk everything up to their endo. But we really, sometimes there's like 3 things going on and we need to work on all 3 of them. So it turned out that she had literally had a piece of placenta inside of her uterus for 4 years since her last baby was born, and it was causing this crazy infection. It was causing such a crazy infection, it actually spread to her bladder, and she also had a UTI. So we had to treat her with antibiotics for her UTI and for her chronic endometritis. And then as we paid closer attention to her hormones and her tracking, we figured out that she wasn't ovulating, right? So now she's in this kind of spiral of she's not ovulating, her body isn't making enough progesterone, she's building up her uterus lining. This poor uterus lining already has a piece of placenta, already has a chronic infection. So we ended up treating her metritis, starting her on ovulation medications, getting her ovulating, and her very first ovulation, after we did all of this work on her, she got pregnant. And she had a really, really healthy pregnancy. And then postpartum, she knew that she needed to go back on a keto diet. So during pregnancy, we of course recommend that we really nourish ourselves and focus on nourishing foods. But then postpartum, she said, you know what? I already learned so much about my body. I already did my glucose monitor. I know what my body needs. And so I just went onto a keto diet postpartum, and I feel amazing. And I lost the weight that I wanted to lose. So she's just a good example of, she had been trying all these things for 4 years and she felt like nothing is working. So let's talk about what to do when you're kind of in that place. Number 1, there is a huge emotional weight, okay? Like, especially if you get your period or you have a negative pregnancy test and you think, dang it, nothing is literally working. It's okay to feel frustrated and tired and discouraged. Like, it really is important to give yourself time and space to grieve and have rest days, because it is depressing, right? Like, it is emotionally taxing to do all of this stuff. We just want to know that those are emotions that we'll have on some days, but those are just not emotions that we want to carry forward every single day. And we don't want to make permanent conclusions from those emotions, right? Like, if we did a diet and it's not working, we don't want to say, I'm just going to give up and start eating badly again. Okay. We want to kind of break it down into, let's figure out what's working and what isn't. Okay. Instead of kind of going to our all or nothings. And then we also want to just make sure that we're literally giving our bodies enough time. For example, if in our patient, she had really severe PCOS and she had a really severe infection, right? Like, that needs to be treated, that needs to be healed. Sometimes we don't actually want to get pregnant right away because we don't want to get pregnant if our uterus is infected, right? And so you do want to take the time to heal those things so that we can prevent miscarriages in the future, have a really healthy pregnancy, prevent ourselves from relapsing. For example, we can put our PCOS into remission, but if we stop being consistent, we can get PCOS back, for example, or sometimes we can put our Hashimoto's into remission. But if we stop being consistent, we can get our Hashimoto's flares again. So it is important literally to take the time to heal our bodies, okay? The other thing is that we don't want to make too many changes at once. And there's a lot of discernment that goes into that, because sometimes, especially with patients, I'll give them a lot of homework, right? Like, okay, we're going to do this and this and this and this and this. And so it's really helpful in that circumstance to know yourself and know what you need. Sometimes having those check boxes is great because you like to do a lot of things and you like to accomplish things really quickly. But sometimes that can actually be really overwhelming. And sometimes if we're making a change, it's hard if we're making too many changes at once, it's hard to know what is working and what's not working. So if it's something where we're going to start a new medication or we're going to start a new supplement. It is helpful to do one thing at a time just so we can tell what's working and what isn't. Okay. And then, of course, consistency is extremely important when we're in that place of, oh man, nothing's working. I think one thing that we want to make sure that we're doing is reevaluate the things that are really important, okay? So reevaluate the basics, reevaluate the boring. If it doesn't seem to be working, just really make sure we're doing our core things, okay? Do we understand our hormone profile? Are we getting enough protein? Are we eating 3 times a day? Are we limiting our processed and refined foods and added sugars? Are we eating throughout the day in a way that makes us feel energized and healthy? Are we managing our cortisol and our stress levels so that we have great energy, we don't crash, we don't feel fatigued? Are we managing our blood sugar? Are we getting the right amount of exercise to support our hormone profile? And are we getting enough sleep? So number 1, go back to the basics and make sure that the basics are consistent, okay? Because sometimes we're doing all the right things and then we just think, screw it. And then we just change all of the things that we're doing, right? We stop eating well, we stop sleeping well, we maybe drink more alcohol, we eat more treats because you're like, oh, well, it wasn't working to be healthy, so I might as well just eat treats, okay? So really make sure we're consistent on the basics, okay? And then we want to get the basics solid and then make slow changes one at a time so that we know what's working. And sometimes we have to do a little bit even more digging. And so we can turn over new stones one at a time, figure out what's going on and treat that specific thing. Okay. Of course, we don't want to overdo it, right? Like sometimes it's easy to go to those all or nothing extremes where, okay, well, I'm just not going to eat healthy and I'm not going to do it, or just doing too much at once, like too much exercise, too many supplements. So that's just something like we do want to find a happy medium and a balance. So just what to do instead if we're feeling overwhelmed, or as a little practical reset, we talked about going back to the basics. So just pick 2 or 3 core habits that we're going to work on each week or each month. Okay. So for example, this month is going to be my blood sugar month. This month's going to be my gut month. This month's going to be my sleep month. This month's going to be my stress reduction month. Okay, because if you feel like everything isn't working, it's actually time to do less and just really make sure that we're doing those things well. And then, of course, it is helpful to get the data that we need to learn about our bodies, right? Like, do we need to do extra labs? Do we need to get some data and track some things to make sure that what we're doing is actually helping, right? So, for example, if we're tracking our hormones with Vera or with Anito or with LH strips, and we figure out that, and we're, our estrogen is low and we're trying to raise our estrogen. So after a couple months, if we've been taking supplements and doing a diet and our estrogen is not getting better, then we want to reevaluate, okay, what we're doing isn't making our estrogen better. So let's change it up, change our supplements, change our diet a little bit, really listen to those cues of our bodies so that we can change what we're doing and get some actual data to see if what we're doing is working, right? So it can be helpful to have a heart rate variability monitor and measure your sleep. So if you are a person who you're not scrolling before you go to bed and you're turning the lights off and you're getting to bed on time and you're, working on your sinuses and your breathing in your sleep, and then you get a sleep score and it's still not good, then we need to think, okay, what do we need to be doing? What do we need to change in order to optimize those things? So having that data and being able to track those things and seeing if what we're doing is having the goals that we want and changing it based on our goals can also be really helpful, okay? And then it's helpful to stay consistent for a set period of time, right? Like we're going to do this for 3 months instead of switching protocols constantly, because we want to give our bodies enough time to listen to the cues of our bodies. And you just want to tell your body, I refuse to be overwhelmed, okay? Like say no to overwhelm. You do not have to do everything. You're allowed to choose a path, stick with it, get your data, look at the data, use the data to slightly veer a little bit off on the path and not completely change paths, okay? So if you're in this place right now, don't overhaul everything at once. Number 1, just simplify it, stay consistent, and then give your body time to respond, okay? If you're in that space and you need help, you need somebody to walk you through those things, please do not hesitate to make an appointment. That is exactly what I specialize in. Thank you so much for joining us on this episode of the Hormone Café, and stay tuned for our next episode.